Good afternoon, everyone. As it was mentioned, I am Dorottya Bastidas-Gergő, and my PhD topic is the assessment of efficacy and safety of natural products in the evidence-based medicine. I am a medical biotechnologist, and currently I'm a PhD student in the Department of Pharmacognosy. My vision is that the evidence-based use of herbal products will be more widespread in the medical practice, and to achieve my vision, my mission is to provide scientific evidence for health professionals to facilitate their work and their evidence-based decision-making when applying herbal products. I have one submitted project and two ongoing ones. The first project is the assessment of efficacy of peppermint on nausea and vomiting. Our aim of this project was to systematically evaluate the efficacy of peppermint oil inhalation for decreasing the nausea and vomiting symptoms in three different populations: postoperative nausea vomiting, pregnancy nausea vomiting, and also chemotherapy-induced nausea and vomiting, and we compared it to placebo. We conducted our systematic search in November in 5 databases. You can see here the hits and also the final search key. We found more than 1,500 articles, and after the full text selection, 16 articles were eligible full text. And now let's jump to the results. In general, we can talk about it that in the articles they use different measurement tools and different measurement scales. So for our analysis, we used standardized mean difference. In case of the patients, their nausea and vomiting severity score was evaluated at baseline, and in case of the postoperative patients, after 10 minutes of the intervention, the patients entered the study spontaneously when they experienced the symptoms. We visualized, in this case, 2 ways the results. In the first one, on the left, you can see that there is a horizontal line, which means the zero effect. If there is a value below the line, then it means that it favors the peppermint oil, and if it is above the line, the placebo. In this case, you can see that after 10 minutes of the intervention, there is a statistically significant difference in favoring the peppermint oil usage. If you check on the right, we also visualize the results in a forest plot, and there is a 0.62 decrease in the nausea and vomiting severity score. And you can see how is the position of the diamond, and it does not include the effect as a size 0, and it is narrow. Then we can also conclude here that there is a statistically significant difference between the two groups. In case of the pregnancy, the women got the peppermint oil daily as an inhalation, and also their scores were evaluated every day. In this case, you can see a pattern over the time that it favors the usage of the peppermint oil. But in case of the chemotherapy patients who also got a daily inhalation, and also their scores were evaluated every day, we really can't see a pattern in this case, but it is because in the articles they included patients with different cancer types, and also they use different chemotherapeutic agents. But also the data shows that it might be promising, but further investigation is needed to find if there is a good combination of the chemotherapeutic agent and the peppermint oil inhalation to reduce the symptoms. So, our manuscript is submitted in this month to the Phytomedicine journal, which is D1 journal. The second topic is a protocol for randomized clinical trial, efficacy of Elixirum TV compositum for children with acute bronchitis. Acute bronchitis is an inflammation of the large airways of the lung, and although most of the cases it is caused by viruses, but still there is high antibiotic overprescription rate for patients diagnosed with the disease. So, because there is no gold standard for treating this disease, but there is a necessity to reduce the symptoms, there is the need for an alternative option, and Elixirum TV compositum might be a good one. It is a Hungarian herbal medicinal product, and it is used for decades for the treatment of the upper respiratory tract, and its active ingredient is the thyme tincture. And our aim is to assess the clinical efficacy and safety of the product to ensure its safe and rational use and reduce the inappropriate prescribing in treating the acute bronchitis. Our clinical question is Elixirum TV compositum safe and effective in the treatment of acute bronchitis compared to placebo? For this, our population is pediatric patients with acute bronchitis. The intervention is the product itself, the comparator is placebo, and the primary outcome is the efficacy evaluated by the bronchitis severity score. Also, we'll check the safety and tolerability and also the necessity of the antibiotic use. So our hypothesis is that Elixirium timicompositum as a standalone or add-on treatment elevates the symptoms of acute bronchitis more than compared to placebo. With the clinicians, we set up the eligibility criteria. I don't go too much in details now because of the time, but we set up the inclusion criteria for children from between 6 and 18 years old, and their bronchitis severity score has to be between 5 and 12. It is also permitted to have a concomitant medication use. You can see there are some disease and some medicine which applied, which will be in the exclusion criteria. And we will have 2 arms as the intervention. In arm A, we'll have the standard therapy and together with Elixirium timicompositum in an age-dependent dosage. And in arm B, we will have standard therapy with placebo. In this case, we would like to ask the company who is producing the Elixirium timicompositum to make for us an identical syrup in taste and color, but of course without the active ingredient. Our primary outcome is the improvement of the bronchitis symptom score, and we would like to evaluate it on day 0, day 4, and day 7. And our secondary outcomes will be the safety and tolerability, and also the necessity of antibiotic use besides the product. And also right now, we are working yet on the protocol, and also we are looking for more collaborators. So if you are open, please contact us. The third project is the assessment of efficacy and safety of peppermint during endoscopy. Every year, there are more than 6 million upper gastrointestinal endoscopies performed only in the US. And to increase the diagnostic accuracy for the detection of the small lesions, that is crucial for it. And the suppression of the gastric peristaltis is a way for that. But antispasmodic agents, which are commonly used to inhibit the peristaltis, can come with adverse events and also are not always suitable for elderly patients with comorbidities. So also here we need an alternative product, and aromatherapy might be a good option for it because it is considered as a mild therapy with no severe side effects. And peppermint oil could be the good option because its main component, menthol, is acting as a calcium channel antagonist, and it has a gastrointestinal smooth muscle relaxing effect. And also, they wrote down that intragastric spraying of the peppermint oil inhibits the gastric peristaltis with fewer adverse drug reactions compared to the antispasmodic agents. An interesting fact, in Japan, the use of L-menthol is accepted officially during the upper GI endoscopies. So, our aim is to assess whether peppermint oil could be used as a quick-acting, non-inferior and safer alternative of antispasmodic agents during endoscopies. For this, our clinical question is, does peppermint oil improve the lesion detection rate during endoscopy in adults compared to placebo? For this, our population is adult patients undergoing different types of endoscopies. The intervention is peppermint oil, the comparator is placebo, and our primary outcome is the quality of endoscopy. Our hypothesis is that peppermint oil as an adjuvant treatment increased the lesion detection rate during endoscopy compared to placebo. We conducted our systematic search in May in 5 databases. You can see here the hits and also our final search key. We found 785 articles, and we finished with the title abstract selection. Right now, 128 articles are eligible, and we will go further for the full text selection. So you can see here also the progress of the project. So in summary, the first project was submitted this month, and also we would like to submit this year our clinical trial protocol and also the second systematic review and meta-analysis. So thank you for your attention. Here is a quote from Marie Curie: "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less." Thank you.
Congratulations on your great work. I would have 2 questions. One of them is regarding the first project. As I saw in your risk of bias tool, for the first and the second domain, there was a low grade of risk of bias. I would be curious regarding the peppermint oil. It has also like specific smell. So how was, for example, what were the placebo characteristics? Like, how was it possible that both patients and healthcare workers were blinded? That's the first question. And the second, maybe just for curiosity, if you have any information regarding another natural product that could be used in patients with nausea or vomiting and its efficacy, if it's also kind of interesting. Thank you very much.
Yeah, thank you for your questions. So for the first I set up here, yes, as you can see that we had some concerns because obviously that is very hard to cover a smell. But in the articles, when I went in details, then first I was checking and they stated that they are blinded. So we discussed about this and they mentioned when we are creating a systematic review meta-analysis and a clinical trial is accepted as blinded in a journal, even if we have some concerns, we have to accept that is how it is. But in the articles, they used a different kind of trying to make the placebo. For example, in some, they used a very, very small amount of the scent to still have something like for the patient. And also in other case, then how they were inhaling, they were doing it on a gauze pad. And before, that was like scented. But before, so maybe it had just a little bit scent of it still for the patient. But of course, I admit that I also saw a very bad example where there, for example, they just stated that they made like in color identical. So that case, doesn't make much sense. But unfortunately, in this case, of course, we will highlight it also in the article. But we have to accept that some clinical trials can be accepted like this way. And going to the second question, yes, there is another, actually, it is ginger, which they used to use in nausea and vomiting. But about this, my supervisor's other team already made a systematic review meta-analysis recently. So we were looking for another product which can be also good. And that is also, of course, efficient about this. But it's nice to have more options.
Congratulations, I'm here.
Where?
Back. Okay, cool. I have some questions. One is, what was the peppermint oil dose did you use? Or did they use?
Yes.
They use the same amount?
Yes, they use the same
What
amount.
was that amount?
Drops. Like
Drops? How
yes.
many drops?
Like 0.2 milliliter.
And how many milligrams, or we don't know about the concentration?
Oh, that was stated in the articles, but it was very similar to all. So we were checking, of course, but finally we were also calculating, and this is what I can say, that it was not diluted.
Mm-hmm. Okay,
Thank
you. The other question is, which chemotherapy-induced nausea was the best reused by peppermint oil?
Well, if I have to judge it, you can see that more like the orange one. That was the best. It's for the FOLFIRINOX.
Mm-hmm. Okay, thank you very much. And concerning the second project, did you combine, in connection with acute bronchitis, the viral and the bacterial versions as well? What made the difference, whether it's a viral or bacterial?
Well, it matters because we would like to exclude if the patients used or need antibiotics. And also during it, we plan that how we monitor them and we evaluate their score. And if from the product or from the placebo, they don't start to feel better, then of course they will need the antibiotics. In that case, we will exclude them during. So it is important for us to have not so very, very severe. And from the bacteria, it can more likely happen.
Sure, perfect, thanks.
Yeah, thanks for the presentation. My question is about the second topic. There are very good anti-tussive agents on the market as well, beside elixirum as well. But I guess the advantage here that it's a natural remedy, as you said, right?
Yes.
But do you know the components of it?
Yes, well, the main component of it is time tincture, but also it contains, first of all, orange.
What is the third?
Uh,
It's a sodium bromide, a very
yes, that's true, but we will use from the Phono 8 version, and that is eliminated from the new version, and they will just start to have it in the market soon. So that was in the 7th version, but we've tried to make the clinical trial later on with the 8th version, and it will be eliminated from
but for decades, these products
Yes.
were containing this well-known antitussive agent.
Yes.
It is a bromide salt,
Yeah.
as far as I know. And the new agent is coming to the market without that and only with the TIMI extract, I guess.
Yes.
Okay, so but we don't know the efficacy of that yet.
No, and it's also very interesting that there is no clinical trial about this product, even although it is used for decades. So even we plan to really just let's find out if clinically is a relevant product or
But
not.
there are ones with bromide.
No, even with that they didn't do. It's like it is used traditionally, but not through the clinical. It's a very special product in this case. It is accepted as a product without a clinical trial.
Okay, maybe it was for other indications. Thank you very much.